Gun violence is a serious public health issue in the United States because so many people are dying. On an average day in the United States, over 300 people are shot. These are civilians, and over 90 are dying. And it's not only the deaths which make it a huge public health problem, it's also the non-fatals. There's lots more non-fatal injuries, talking about spinal cord injuries, traumatic brain injuries, than there are gun deaths. And even more than that, it's that gun violence can destroy communities. People are afraid to go out. Industry is afraid to come in. A little bit of gun violence can really destroy a community. Since the early 90s, crime in the United States and throughout the developed world has gone down, and nobody quite seems to know why. And when crime went down, also, of course, gun crime went down. What's been increasing in the last 5 years has been gun suicide, which is always more than gun homicide, and also these mass shootings. When you compare the United States to all the other high-income countries, as defined by the World Bank, or all the other first world countries, we have so many more guns than these other countries, particularly handguns. We have by far the most permissive gun laws, and I would argue, not surprisingly, we have so many more gun deaths. We were looking recently at the 5 to 14-year-olds, the K through 8s, and a child in the United States compared to a child, say, in Great Britain, or a child in Italy, or a child in New Zealand, has a much higher chance of being murdered with a gun. And it's not 20% or 50% or twice as much. It's 18 times more likely that a child in the United States will be murdered with a gun than these other children. It's something like 10 times more likely that they'll commit suicide with a gun. It's 10 or 12 times more likely that they'll be unintentionally killed with a gun. The public health approach is trying to figure out ways to make it easy for people to be healthy and difficult to be sick and injured. One of the things I will always say is that there's so many successes in public health that it makes you very optimistic. You're trying to not blame people, because too often in the United States we blame people and it's somebody else's fault. We don't have to do anything. You're trying to get everyone together to work on the issue. And it's not just laws and punishments. What you're trying to do is often change social norms. I think one of the big things about the public health approach is you try to step back and think, how could we prevent this problem, and how could we get everyone on board to help prevent this problem?